Like people, our pets require medical attention, which sometimes may include surgery or anesthesia. So, is that safe? Is surgery or anesthesia the best option for your pet? On today's show, we will look into surgical options and what you need to know. And as always, we are here to answer your questions. All that and more coming up on this episode of Ask the Doc, No Appointment Needed.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hello, and welcome to Ask the Doc, No Appointment Needed, the show where the questions you send in are answered by our medical professionals. All right, guys, got a little bit of a sore throat today, so I'm channeling my inner Miley Cyrus, so I'm so sorry. But I'm Dr. Joy Carter, Doctor of Veterinary Medicine, and I'm really excited for today's episode. It's a fun topic that I want to educate everyone on. So let's get straight to your questions, guys. All right, our first question comes from Will, and he emailed us. Hey, doc, my 9-month-old puppy is getting spayed next week, and my vet recommends pre surgical blood work. She seems very healthy. So, is this really needed? All right, Will. So technically, you can spay or neuter a pet without blood work. A lot of pets are done that way, typically at animal services or kind of at low cost clinics, but it is definitely 100% recommended. Okay. The reason why we recommend pre surgical blood work is we want to make sure there is nothing abnormal on that blood work or nothing going on internally with your pet that could affect them under anesthesia. Okay. Important things that we're going to be looking for on blood work. So, first thing is on your CBC, also called your complete blood cell count, is we're going to look at your white blood cell count. Is it elevated? Is it low? Could it be indication of some type of infection or inflammation? We're also going to be looking at your red blood cells. Is the pet anemic? We don't want to take an anemic pet to surgery. We know there's going to be some blood loss. We don't want to make it worse. What about the platelets? Platelets are your body's first defense mechanism, or basically the first thing that helps your blood clot. Whenever you do surgery, there is going to be bleeding. If you have low platelets, you can bleed excessively, okay? And you don't want that to happen. Now, as far as what we call the chemistry panel, that gives us an idea about internal organ function, okay? It looks at a lot of different things, but the main things we are focusing on the blood work is going to be like your liver and your kidney values and things like that, okay? The reason why is a lot of these anesthetic drugs are going to be metabolized by those two organs, by your liver and by your kidneys. If they are not working properly, then it can affect anesthesia. Okay. It can be a longer recovery. They may not do very well under anesthesia. So, definitely when it comes to elective procedures, that means surgeries are not an emergency. That's going to be like your spays and your neuters and things like that. Okay. Pre-surgical blood work is recommended because we want to make sure that your pet is safe to go under anesthesia and safe to get the procedure. So yes, Will, why I hope everything is fine with your dog's blood work, and it probably will be. Definitely, your vet is not just telling you to get blood work done to make money. It is definitely recommended, and hopefully I answered your question as to why. All right. All right. So our next question comes from Leslie, and she also emailed us in. Our vet suggests we bring our baby girl in for a procedure, but says they have to put her under. She was telling me about something called reversible anesthesia. What is that? And is it safer than regular anesthesia? All right, Leslie. So technically, all anesthesia is reversible in the sense of once the drugs are metabolized by the body, eventually, you will wake up. The same thing with anesthetic gases like your isoflurane and your sevoflurane that you put them on when they're under general anesthesia. Once you stop giving them that gas and it gets out of their system, which in most cases, can be several minutes, they will wake up. Now, what your vet is probably talking about is probably some type of sedation that is reversible. Okay. So there are some drugs, some have been on the market a little bit longer than others. But in particular, we have a drug called dexdomitor. okay? It is dexmedetomidine is the actual, drug name, and it is a alpha 2 adrenergic agonist, okay? Don't worry, if you guys want to Google everything and see what it is, you can, but let me explain it. So basically what this drug does, that the reason we use it for sedation is it suppresses or depresses the CNS, the central nervous system, which causes sedation, which helps with anxiety, okay? It does have some other side effects, so that's why it's very important to have these pets under sedation monitored. It definitely does lower the heart rate. A lot of times it will initially increase the blood pressure, but then after that, it can lower it. So, you have to be very, very careful when you have them under. Now, there is a newer drug that kind of is a little bit similar to dexdomitor. It's called Zen Alpha. It has another kind of derivative of that same 2 alpha 2 adrenergic agonist. It's called metomidine. And then it has another drug in it, I think it's vatanoxine. It's supposed to be a little bit safer than just dexdomitor. The reason why is that other drug is supposed to kind of counteract the negative cardiovascular effects, like the decreased heart rate, the decreased blood pressure, and things like that. Now, both of these drugs, they do have kind of a reversal agent. It's called antipamazole, all right? Basically, those 2 drugs, you can give them intramuscular, you can give them IV, you can combine it with other anesthetic or, drugs such as opioids, benzodiazepines, like your Valium, your midazolam, different things like that, okay? And then you can reverse it with this other drug that you give intramuscularly. And a lot of these pets, they will wake up and be up and able to walk around within 15 minutes, okay? With a lot of the other drugs that you use for anesthesia, like I said, it can be a little bit longer time period for those drugs to wear off, such as sometimes some hours. So I'm assuming, Leslie, that is what your doctor is talking about, okay? As far as sedation, there are risks with it, okay? But that definitely, if you have any concerns or questions, that's something to bring up with your doctor. But as far as reversible, like I said, all anesthesia to effect is reversible. The drugs either get out of the system or either you turn like the gas off and then they also metabolize it, okay? So hopefully that helps answer your question, Leslie, all right? All right. So our next question comes in, I think it's from Caroline. All right. And she wrote us on Instagram. My baby is at least 10 years old and maybe older. We are going to the vet this week and are concerned they will say he needs a surgical procedure. What's the truth? Is it safe to put an older dog like him under anesthesia? All right, Carolyn. So they have a saying in humans, we have a saying in veterinary medicine, age is not a disease, okay? Now, as you get older, as pets get older, they definitely can have more health concerns or develop some health problems, which in a sense can sometimes make anesthesia a little bit harder on them, okay? But definitely we have a lot of new drugs, a lot of new protocols. I mean, as far as monitoring and things like that under anesthesia, we've got a lot of things in veterinary medicine that obviously they also have in human medicine to be able to make anesthesia safe for older pets, all right? My last dog that I had, my Pomeranian Gidget, she lived to be 18 years old. I remember the last time I put her under anesthesia was for a dental cleaning, and she was like 16 and a half years old, and she did perfectly fine, okay? So the big thing is don't be scared to put your pet under anesthesia just because it's older, all right? Your veterinarian is going to do the proper protocol, okay, which typically is going to include pre-surgical blood work, obviously a thorough physical examination. If there's any abnormalities detected on physical exam, such as a heart murmur, they may recommend echocardiogram, EKG, chest radiographs, things like that. They're going to do the proper steps needed to be able to make anesthesia as safe as possible for your pet. And also, too, you want to make sure your pet has regular checkups, okay? The last thing I like doing is putting a 15-year-old dog with a rotten mouth under anesthesia for a dental cleaning and for teeth extraction when things like that could be prevented. Now, sometimes that's not the case, okay? They need emergency surgery or something happens, but just because your pet is older, Carolyn, does not mean that they cannot be put under anesthesia, okay? All right, so good luck, Carolyn. All right, we got some great questions so far, and we still have some time to answer your questions. Here's how you do it. Check this video out.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, we just got a question from Casey, this time from our Facebook page. Hi, dog. My dog was sedated to suture a bite wound from another dog. What exactly is the difference between sedation and anesthesia? All right, Casey, this is a really good question. Okay, so when it comes to sedation, sedation, a pet or a person is not completely unconscious. Like they, in a sense, sometimes can still feel a little bit of pain. They can still breathe. They can still, kind of move, things like that. They still are kind of aware to a sense. Okay. Now, depending on the level of sedation, it can be very mild to very heavy sedation type of thing. When you're under general anesthesia, a person or a pet, okay, you are completely unconscious. You don't know what's going on. You cannot feel anything and you cannot move. So as far as procedures that are going to be very painful, or your major surgeries or procedures that are going to last for a long time period, that's when general anesthesia is used, okay? Sedation, typically, as far as in pets, we use it for very short procedures. We use it sometimes to take radiographs. We use it, when a pet is just not cooperating, because unfortunately, when pets get stressed out, there can be a lot of negative effects with that. So if your vet tells you, hey, listen, your pet's freaking out, your pet's really stressed, let's give your pet a little bit of sedation to relax them. Do not be scared, okay? Express your concerns, all right? And say, hey, if you don't mind me asking, what are you going to be using? How sedated will my pet be? Your veterinarian should have no problem when answering that question, okay? But you don't need to be scared of it, all right? So hopefully that answers your question, Casey, okay? All right, so now we got another question. All right, this is gonna be from Mac. Hey doc, my dog had surgery last year from an obstruction. The medical team was great and they made me feel really comfortable. I was wondering, do they train anesthesiologists for pets like they do for people? All right, Mac, yes, they do. Okay. So there are board certified anesthesiologists. And actually, one of my former colleagues, hey, Dr. Rufato, he is a boarded anesthesiologist. Now, okay, you're not going to find an anesthesiologist at your general practice, okay? And probably not at your emergency hospital. These boarded anesthesiologists, they are going to be at very big specialty hospitals, or they are going to be at universities. The reason why is, okay, these guys went through a lot of school, more than what I went through, okay? And so they are a little bit expensive, okay, for their services. So it doesn't make sense for most veterinarians to have a board certified anesthesiologist, because most of the surgical procedures they're going to be doing are going to be pretty routine, pretty elective. And if it is an emergency procedure, they obviously can still know what to do. All right. I do know some board anesthesiologists that are kind of traveling, in the sense of that if they have a patient who needs surgery that has very critical illness, say they have very severe heart disease and liver failure, or anything else that could make anesthesia more complicated, they will sometimes hire him or her, and that person will do anesthesia. Now, at your regular veterinarian clinic, the person who's doing anesthesia is going to be your vet. Now, that as far as they're going to be coming up with the anesthesia protocol, as far as what drugs to use for pre-medication, for induction, pain control, all of that stuff. Definitely veterinary technicians or veterinary nurses are going to be the one that are going to be monitoring your pet under anesthesia. Same things, I think, like what you would think like a nurse anesthetist, okay? You got your anesthesiologist, and then you got your nurse anesthetist, which work under them, okay? So yes, while we do have board certified anesthesiologists, hopefully that is not something that your pet would ever need, Mac, okay? Because typically that happens, that means that your pet is having a really, really big surgery. But yes, there are, and it definitely is an interesting career. So if anyone's interested in that, go for it, all right? All right, this one I think is from Nicole. She emailed us in. Hi, Dr. Joy. All of these questions have to do with dogs and cats, but I have a bearded dragon. Do vets perform surgery on exotic animals as well? All right, Nicole. Yes, they do, actually. So I have a really good friend and colleague, Dr. Kushner, who does a lot of stuff with exotics. Okay. If you follow his Instagram page, he has so many pictures and videos of putting the chimpanzees under, of sedating alligators, turtles, owls, hawks, like all kind of different animals. I actually have done sedation or anesthesia on a bearded dragon myself. Okay. I had a case with a bearded dragon who he was at a pet store, and unfortunately, one of the other bearded dragons in the cage decided to attack him and basically almost chewed his leg off. Okay. So I just kind of had to amputate what was left. He did well under surgery, and we actually named him Lieutenant Dan for those of you who kind of get the joke. But yes, yes, anesthesia can be done on all different kinds of pets. I will say this, I have also anesthetized a turtle. That was interesting because the thing is turtles hold their breath. So I had to use a combination of giving, injections kind of intramuscular, and then also using like anesthetic gas. But the thing is turtles can hold their breath for 30 minutes. So sometimes it can take a while to sedate them, but luckily this turtle went down very quickly. I have sedated rabbits or put them under anesthesia. I mean, any type of animal you can. Obviously, the protocol and things that you do is going to be a little bit different for exotic animals, but 100% they can be put under surgery. And actually, fish can be anesthetized. Don't ask me how they do it. I think they do something and put some anesthetic stuff in the water, but actually, yes, fish can be anesthetized too. So, really, really good question, Nicole. Thank you so much for asking. All right. Like I said, really good question, guys. Keep them coming. All right. And if you're not sure what to do, check this video out, how to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right. So Yoli reached out through Instagram and she writes, my brother-in-law wants to make his dog a service animal. It's not that he needs a service animal. It's because he wants the pet to fly for free, and also so he won't have to pay pet fees at his apartment. What are your thoughts on this? All right, Yoli, I think this is a question we didn't get to last week, and I'm so glad that I'm getting to it now. Okay. Absolutely, guys. Do not make your pet or try and make your pet a fake service animal. Okay. It's just like parking in a handicap parking space. If you are not disabled, you don't need to park there, and you know that it is wrong. Okay. Now, listen, if you want to make your pet was considered an emotional support animal, go for it. A lot of places, if they are emotional support, will not require you to pay pet fees. Not every place. Places are getting a lot stricter. Now, the problem is some of those places you have to check with your apartment complex, with your HOA, whatever. They may require a doctor's note, okay, saying, hey, you have some type of medical condition, whether it be anxiety or depression or panic attacks or whatever it is that you need to have your pet with you to be able to help, control this problem. All right. If you've got a friend or someone or a doctor who's willing to write that note for you, then go ahead. Okay. Your vet is not the one who makes your pet a service animal or an emotional support. Okay. There's places online that you can go online and register them as an emotional support animal. And I will say this, I have done that myself. Okay. Not a service animal, an emotional support. I did it because I didn't want to pay pet fees. Okay. That was solely it. But guys, listen, do not make your pet a service animal or say it's a service animal if it is not. These animals, these dogs that are trained to be a service animal, they are there for a specific reason, for a specific job. These dogs are very, very highly trained. Okay. And what happens is, unfortunately, when you say that your dog is a service animal and is not really, and your dog causes a commotion, say on an airplane, uses a bathroom on the airplane, starts barking like crazy, tries to bite someone, is jumping all over people, things like that, then it makes it harder for people who are disabled, who really do need service animals, okay, for them to be able to get their pet on the plane, to be able to take their pet while they need to. Listen, South Florida is super pet friendly. You can pretty much take your pets almost anywhere, okay? So you don't need to make them a so-called fake service animal. And just so you guys know, listen, all of us vets, when we see your dog walk in and it's got that little service animal sticker or harness on, we know when it's really a service animal and we know when you're faking it. We're not going to say anything, okay? You know, because it's still your dog and we think it's cute, but we definitely know, okay? All right, so listen, Yoli. Like I said, tell your brother-in-law, no, 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 no. If he wants to make it a emotional support animal, you've got the green light with me, but service dog, no. Okay. All right. So let me get off my soapbox. This is our next question. It's from Arlene, and this is from Instagram. My neighbor has a pet snake, which I thought was crazy. I'm curious, what's the most exotic animal you have treated? What exotic animal would you recommend us getting? And more importantly, which exotic pet should we stay away from and why? All right, Arlene, we got a lot of questions. Okay. So, as far as the most exotic, I would say I treated a wallaby. Okay. I don't know if you guys know what a wallaby is, but it's like a mini kangaroo. Actually had a wallaby that came into the emergency hospital when I was working at Veg. The people, I'm assuming, had a permit to have it because a lot of exotic animals, depending on what they are, or especially wildlife, you do need to have a permit. But anyway, apparently, I think their dog had like pulled on its tail and he was acting painful and they were concerned that it had a fracture. Oh my God, he was so super cute. I'm not going to lie. I got lots of pictures. I got lots of videos because I was like, when in my life am I ever going to, treat a wallaby again? So I would probably say that's my most exotic animal that I've treated. All right. As far as what exotic animal would you recommend getting? So that depends a little bit on your lifestyle, Arlene. Okay. Reptiles are really good in the sense of that there's not really a lot to do to take care of them. Now, definitely you need to read up on husbandry things like as far as their environment, like what temperatures and do they need a light source and all of this other stuff. But a lot of reptiles like snakes, like you really don't have to feed them, but every like 2 weeks. And my sister's got two snakes, which I don't understand why, but she loves her snakes and that's okay. But those are good pets if you're going to have a busy lifestyle, if you like to travel, okay? You can have someone, if you're gone, come over and feed your pet snake, while you're gone, and then that's it for the one time. If you want something that's a little bit more cuter and a little bit more fluffier, I do recommend rats. Okay. Everybody's like, but rats are actually pretty smart animals and they make really good pets and they can be very social. Ferrets are another one. I will say this though, ferrets are like little mischievous cats, okay? And you do have to be careful with them because they will get into trouble and do things they're not supposed to. A rabbit is another really good option. I have treated a lot of rabbits or seen a lot of rabbits, and I think they make really good pets. All right. As far as an exotic pet to stay away from, I don't know if I would say there is one per se. I would think, you obviously want pets that are legal to have. Listen, there are breeders online and things like that. I mean, I would say probably one exotic pet is a big no-no is a monkey. Okay, guys, listen. Nobody needs a monkey unless you have the proper licensing or the proper place to house a monkey, okay? They are super cute, don't get me wrong, all right? I had a friend who had a monkey when I lived on the island of St. Kitts where I went to vet school, but they can cause a lot of problems. So if I was gonna say stay away from one animal, I'm sorry, guys, it would have to be a monkey, all right? So I think that's going to be all the time that we have for our questions, but I just kind of wanted to go back and talk about some things. So, all right, when it comes to sedation, when it comes to anesthesia, when it comes to surgery in your pet, all right, there is a saying, there is no safe anesthesia. There is no safe like anesthetic drugs. There are only safe anesthetists, okay? Everything that we give your pet to sedate them or put them under anesthesia obviously can have negative side effects. And if things are not given in the proper dose, things like that, there can be consequences. All right. As far as anesthetic deaths, okay, and human medicine, it's like 1 to 2 deaths every 200 to 300,000. Same thing in veterinary medicine. It is less than 1%. I think it's like 0.11 to 0.24 as far as anesthetic deaths. Okay. So do not be scared of anesthesia. If you have questions, if you have concerns, speak with your veterinarian and he or she should address that. If for some reason you don't feel comfortable with a certain vet, then get another veterinarian. There are a lot of good veterinarians out there that will take the time, okay, to sit down with you and explain exactly what they are going to do with your pet and why it needs to be done. And hopefully this show is helping educate you guys so you don't need to worry about that. Because the last thing we want to do is have to put a pet under anesthesia when it could have been done earlier, but it's now being done later, but say a pet parent was scared. All right. All right, guys, that is all I have time for. So I will see you guys next week. So thank you so much for joining me. And I hope you guys learned something today. Bye.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.